Hi, my name is Rebecca DePietro. I'm a licensed practical nursing student, and it's November 3rd, 4th. And I'm going to be doing a head to toe assessment. First thing I'm going to do is wash my hands, turn on the faucet, wet my hands, and take my soap, soap my hands, and then I'm going to wash with my fingers down for 15 to 20 seconds, making sure that I get my wrists and in between under my fingernails. Everything. Alright. Then I'm going to take my paper towel and wipe my hands. Pat my hands dry, not wipe them. And then I'm going to take a second clean paper towel and shut off the faucet. Okay. Then we're going to go in here. This is my patient. Hi, how are you doing?
I'm doing well, thanks. How are you?
Doing great. My name's Rebecca. I'm going to be your nurse today. We're just going to do a head to toe assessment or a physical assessment, okay?
Good.
It'll take about 20 minutes. Could you tell me your name?
My name is Jane Preta,
And your date of birth?
2/7/26.
Perfect. All right. Can you tell me what town we're in today?
Portsmouth, Rhode Island.
And who's our president?
Trump.
Yep. And what year is it?
It's 2018.
Perfect. So you're oriented ×3. You know where you are. You know who you are. You know what's going on in the world. So the first thing that I'm going to do is ask you, are you having any pain today?
Yeah, my lower back.
In your lower back? Could you point to where it hurts? Oh, perfect. Okay. And on a scale from 0 to 10, 0 being no pain and 10 being the worst pain that you've ever felt, how is it feeling?
4.
4? Okay. And what kind of pain is it? Is it throbbing, stabbing?
No, it's not throbbing or stabbing. It's just low, steady.
Maybe achy?
Yeah.
Okay. All right. Okay. So I'm just gonna check out like your sensory motor, so your like cranial nerves. Could you smile for me? And frown? What about stick out your tongue? And can you stick your tongue to either side? Perfect. And then what about raise your eyebrows? Good. And puff out your cheeks? All right. Do you have any numbness or tingling in any of your extremities, fingers, toes?
I have tingling constantly in my toes.
In your toes? Okay. Well, when we get to your toes, we're
But
gonna...
that's because my circulation is poor.
Oh, okay. All right.
So it's perfectly normal.
Here's what I'm gonna have you do. I'm gonna have you put your arms out like this. Can you push up against my hands and then push down? All right. And then hold my hands, squeeze. All right. Perfect. Wow, you're really strong. And then just go like this to show me that you can move your elbows. Can you just move your like shoulders? Good. And then your wrists. Good. So your range of motion is good. You don't have any aches or pains when you do that?
No.
All right. So the next thing that we're going to do is we're going to have you raise one leg at a time. So like this, and then the other one. And then could you do that against do one at a time. Yeah. And then the other one. Good. You're really strong.
So are you.
Okay, then we're gonna do your strength in your feet. So I'm gonna put my feet like me my hands like pedals, and
Should
I want.
take my shoes off.
We could do that, yeah. At some point, I'm gonna have to do your pulses in your feet anyway. So, put your feet against my hands and then push like car pedals. Good, good. So, on both sides, you're equally strong. I don't feel any weakness when you do that. So the next thing that I need you to do is just get up and take a couple of steps for me so that I can make sure that you're not unbalanced. Walk forward towards me. Good. Okay. And then you usually use a cane, right?
Yes.
Okay. Do you feel unsteady without your cane right
No.
now, taking a few steps? Good. Because you're equal. All right, we're going to have you sit back down because your gait's good, your mobility is good, your strength is good. The next thing that I would do is I would check all of your skin for bruises, rashes, things like that. When you were getting dressed this morning, did you see anything abnormal or feel anything abnormal that you wanted?
No, because normal for me is uncovered keratosis.
Right. And you bruise easily, right? Because of your
Because I'm taking Coumadin.
Coumadin. Yep. Okay. But nothing abnormal that you want me to check out or anything? Cool. All right. So the next thing I'm going to do is I'm just going to feel your scalp. If you feel anything abnormal or anything feels strange, just let me know. I'm just checking for any lesions or any bumps, anything like
Yeah,
that.
these two things that go up into my head are tight.
Oh, yeah. Your neck muscles here?
Yeah.
It's because your head is so heavy. Because you're so smart. Just checking your ears for any bumps. Checking your lymph nodes. Seeing if I feel anything in your neck muscles or your neck veins. Everything feels fine. Do you feel any pain or tenderness when I do that?
No.
Okay. So the next thing I'm going to do is I'm just going to have you sit back against the couch and put your head just comfortably against the back so that I can check out so just lean back, put your head here. Put your head back against this pillow. So I'm just checking out your neck muscles here, making sure that your trachea is midline, and could you swallow for me? Looks good, okay. And then I don't see any jugular vein distension, nothing out of place here. I can feel your carotid artery there on the left. And here on the right. Both are bounding and
Yeah.
working.
And I have this huge pacemaker.
yeah, when I do your heart sounds, that's gonna be a little hard. All right, perfect. So the next thing that we're gonna do is I'm gonna take a look at your eyes. It's a little bright in here, so I'm just gonna shut the curtain behind you.
Okay. Yeah, that's better.
Yeah. Okay, so
Should I take the glasses?
if you could, thank you. All right, so your pupils are centered and they're round and they're equal. Your sclera is white. Could you just pull down one of your, yep. So your conjunctiva is wet, it is pink, it's moist, it looks like it's good. That one looks good too. All right, so the next thing that I'm gonna do is, so we did your pupils, we did the roundness, we're gonna see if you're reactive to light. So if you could just look forward for me. All right, so that one constricted. That one constricted too. The next thing that I need you to do is just watch my pen light as it comes in towards your nose, okay? Good. So you accommodate well. You can, see in your peripherals and stuff like that. To light. Accommodation, round, equal, got it. All right, so I'm just gonna take a look at your ears. I already felt your lobes to make sure that there weren't any bulges or anything like that. Looks good. Can you hear me? You don't have your hearing aids in. All right.
But I have a ton of wax in this ear.
It looked pretty good to me. It wasn't red or like
Good.
moist in any way.
Good, because I've been using Debrox.
Oh, really?
Yeah.
All right. The next thing that we're gonna do is take a look at your mouth. Your lips look good. Could you smile for me? All right. And your gums look good. Stick out your tongue. Say ah. Looks good. All right. So everything's moist. Everything's pink and looks good. Have you had any sores or any trouble swallowing?
Oh, I have trouble swallowing.
Yeah.
Yeah,
So
but that's old.
does like your doctor knows about it?
Yeah.
Okay. Wow, I'm learning a lot about you. Okay, so the next thing is I already checked out your neck. Have you had any dizziness?
I had a fall 6 weeks ago, and after that I had a lot of dizziness. But that's going away now.
You had vertigo for a little while,
Yeah.
right? Okay, so it's getting better with physical therapy and everything?
Much better.
So your dizziness has improved?
Yeah.
That's good, okay.
And
So,
I do vertigo exercises every day.
also for balance and to get that back. Interesting, very cool.
Sitting right here.
This is your exercise too.
Yeah, and one of them is to take a pen and follow it without moving my head.
Kind of like what I just did. That's cool. Okay, so the next thing I'm gonna do is I'm gonna listen to your heart, okay? So I need my stethoscope. Where did I put it? Ah, thank you. So,
You'll hear lots of funny little beats.
I know, I'm actually kind of excited. So the first thing I'm gonna do is I'm gonna listen to, there are 5 heart sounds, alright? So on your right side, at your second intercostal space,
Take this off.
thank you.
Here, pull. Thank you. This is the darndest to get on and off, but it keeps me nice and warm.
This is what it would be like at a real doctor's office, so whatever. Alright, so on your right side, at your second intercostal space, you have your aortic valve, okay? So that's gonna be like right here. Wow. Alright, then on your left side, at the second intercostal space, you're going to have your pulmonic. And that's where your pacemaker is, right? Right there. Yeah, I can like kind of hear it. Then I'm gonna go down to your third intercostal space, and I'm gonna hear your Erb's point. Then I'm gonna go down to
What's that mean?
the Erb's point. It's just your third heart sound.
Okay.
Then we're gonna hear your tricuspid, which is gonna be at your fourth intercostal space on your left side. And then on at your fifth intercostal space, mid-clavicular, you're gonna have your your apical or your mitral sound, and that's where you can hear all of the 4 chambers all at once. So generally there we listen for a whole minute so that we can actually hear what's going on. I can hear your AFib. You have a little, but it's really strong, and it's kind of like beat, 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 beat.
Yeah.
Wow, that's really cool.
I know, 'cause I can feel it if I put my hand here.
No way.
Mm.
That's crazy. Well, you know, that's pretty cool. The next thing that I'm going to do is I'm just going to feel both of your radial pulses. That one is strong. That one is also strong. And your rhythm on your pulses are steady. So then what I'm going to do is I'm going to take off your socks, okay? Because I need to do your pedal pulses.
Love these socks. They're easy to get on and on.
Yeah, they're
And
good.
they keep me nice and warm.
So you have two pedal pulses. You have a dorsal pedalis, which is here on the top. And then you have a posterior tibial, which is back here.
That's a little bit tender.
Yeah, you do have a little bit of edema, which is the next thing that we're gonna do.
That's because yesterday I ate salt.
When you're on a no salt diet. All right, so to assess edema, what we're gonna do is we're going to push down for 30 seconds to a minute. And then we're going to assess how long it takes for it to come back up. 1, 2, 3. I'd say that that's like 3.5, 4. So I would say that you had 6 plus edema. But if you wore compression stockings or if you just lay off the salt, you'll be okay. Okay? All right. Sorry. So then I forgot to do your capillary refill.
This is the best physical I've ever had.
So capillary refill tells me how hydrated you are. And basically I just push down next to your nail there, and what I want is for the pinkness to come back fast. And so you actually have pretty good capillary refill, so you've been drinking your water. Or you've been drinking.
This morning.
Good. All right, so
Not
I'm gonna
always. I'm not good about it.
Who is? I'm gonna do the same thing on your fingers. Just make sure that you're not dehydrated. All right. Yeah, you have good capillary refill there too. All right. The other thing that I'm gonna do is I'm just gonna check right next to your clavicle here for skin turgor. I'm just gonna pinch and make sure that it doesn't stay tented or stay pinched for very long. Again, you have good rebound, so you're hydrated and doing well. Have you had any nausea or vomiting? Have you had any weirdness in your stomach or feeling
I had a lot of nausea when I had vertigo.
when you had
But
the dizziness?
I don't.
It's getting better?
Mm,
Good.
Much better.
Okay. So the next thing I'm going to have you do is I'm going to have you lay down so I can check your, what's it called? Your
My-
gastrointestinal
Yeah.
area. So the first thing I'm going to do is look. It looks good. You're not distended. You're not having any bulging or anything there. Have you had any problems with voiding or,
Oh, I always have problems with voiding.
okay?
I void not meaning to.
Yeah, so you're a little incontinent.
Yeah.
All right.
Little, a lot.
With both stool and urine, or just
No.
urine?
No, just urine.
Okay, well, for somebody your age, that's normal.
Normal.
The first thing so now that I've looked, I'm gonna listen because I want to see if you're having bowel sounds. I'm gonna start in your lower right quadrant. Then I'm gonna go to your upper right quadrant. Then go to your upper left quadrant. And go to your lower left quadrant. What I would expect to hear is 5 to 15 clicks and turns, and that's what I heard. So It's all moving around in there. It wants to come out. Then what I'm gonna do is I'm gonna feel. Does any of this hurt?
That's a little bit tender.
Tender right there?
Yeah, well, it's tender on this side because that's where I have my hip.
Oh, your hip replacement. Okay. All right, so let's have you sit up and I'm gonna listen to your lungs. All right. So I'm gonna listen in the back first. Just breathe normally. I'm gonna start, not over bone, but on like towards the scapula on the top here, and I'm gonna be listening to your alveoli. Here's where I would be hearing like wheezes or any asthmatic or COPD symptoms. Then I'm gonna go around in a S kind of pattern. Just breathe normally. Good job. As I get lower, this is where we would be able to hear deeper sounds, so any type of fluid or air in your lungs. Usually pneumonia is heard down here. And your lungs sound clear. Have you had any wheezing or coughing? Good.
No.
All right, so I'm just gonna move to the front. And in the front, I'm gonna have you breathe deeply, okay? So deep breathe in and out. Good. Perfect. Great. Okay, so lungs. So the next thing I just need to ask is, when was the last time that you did void?
About half an hour ago.
Did you have any pain or discomfort when you did?
No.
All right. And when was the last time you had a bowel movement?
Last night.
Was it normal and
Yeah.
okay? Any pain or discomfort?
No.
Is that normal for you to have one last night and then not?
Usually it's in the morning.
Interesting. Okay. No diarrhea or?
No.
Okay. Do you have any questions for me?
No, I think this is probably the most thorough
Is there
that
anything?
I'd ever had.
I know. It's really, really long. Like, this is like the longest. Is there anything that is bothering you that I didn't touch on?
Blood pressure.
Right. Blood pressure would be with your vitals, so I would do your respiration, your pulse, your blood pressure, your temperature, and everything like that.
But that's
Like,
not
that's
part of
this video, exactly.
Okay.
All right. Well, thank you for being a great patient, and that's my head to toe video.
Thank you.